The precautions that need to be taken before doing a skin prick allergy test. As you know, the allergy tests are done on the skin called the skin prick test is the most common, most reliable test for identifying allergies and whether a person is sensitive to allergens or not. Now, this test is done where the antigen is placed on the skin, and with a lancet, there's a nick is made and we look at the reaction of the skin. Now, for a good skin prick allergy test, for a good interpretation, there are precautions to be taken. One, the person should not have taken anti-allergy medicines, anti-allergy syrups, antihistamines, cough syrups, many common cough syrups which contain the anti-allergy antihistamines should be avoided at least for 7 days before doing the test. If the person is taking Ayurvedic medicines, homeopathic medicines, that should be avoided. Those medicines which are not required, like many of the multivitamins, herbal medicines, natural products, these things are, we suggest that person avoid these medicines at least for a few days. Now, there are some anti-allergy eye drops, there are some anti-allergy nasal drops, nasal sprays. So, these need to be avoided for at least for 3 days before doing the test. Now, person should be comfortable. He should not be sick at that point, because we do this allergy test on patients who have skin allergies, allergic rhinitis, allergic asthma. So, the person should not be having much of wheeze. He should not be having any chest infection. The person should not be suffering from fever on the day of the test. We do this test on the person's skin on the upper arm or sometimes in the back, so that the suitable dress should be worn so it's easy for test to be performed. A person should not have applied any moisturizing creams or lotions or conditioners, sunscreens on the day of the doing a test. Now, there are some patients who have a lot of urticaria, a lot of skin rashes. So those patients becomes difficult. So we need a much more area of the skin to the allergy test. Whether the patient can have any food before doing the test, yes, patient can have his usual food doing the test, except that if the person is known or he's suspecting that he is has a past history of doubtful allergy to certain food items, that has to be avoided at least for about 2 days before doing the test. This way, with due precautions, we do an skin prick allergy test. We expect a good interpretation, because we expect at least about 75% we are able to identify the allergen possible sensitivity for that patient. Thank you for listening. I am Dr. Krishnan at the Allergy Asthma Center, Kochi.